The Tribal Health and Human Services Department of the Confederated Salish and Kootenai Tribes is proud to present Good Medicine, a program dedicated to the wellness of the Flathead Nation. The mission is summarized quite simply: a healthier people, a stronger nation. We will strive to make Good Medicine a reliable source of ideas and information about health issues so that everyone can make informed decisions about their own lifestyle and health care. You will meet health professionals, tribal government and spiritual leaders, and interesting people from the tribal community discussing important health issues that profoundly affect us all.
Hello, this is Good Medicine. I'm your host, Larry Pitts. Today we have one of my most distinguished guests. That's Barb Plouffe. She is our public health nurse from the Ronan Community District and team, actually. And Barb, welcome aboard. And is there anybody you'd like to say hello to before we get going?
Oh, just whoever's out there watching this.
All right. Hey, you sound a little apprehensive, Barb. Just a little curious,
yeah.
Huh? All right. You know, Barb, we want to talk about the community health team from Ronan a little bit. We want to talk about some things that are coming up that you guys are promoting from your team. To give a little publicity for your team, who's on your team at the Ronan Community Health Team?
Okay, there's 2 public health nurses, myself and Wendy Duran. We have a secretary, jack of all trades, Carol Finley, 2 CHRs, Marlis Santos and Char Hunter, and then Dennis Webster at the fitness center are part of our team.
And how do you know, you guys have been doing this, what, for 2 months now?
About that.
How's it working?
I think it's working pretty good. We haven't had to change a whole lot in the way we did things. It's just that we have more people to help us do things. We're getting busier, but I think that's across the board.
And do you see this as a benefit for the people as far as, you know, the coverage that we're going to be able to give people? Or?
I think it will be a benefit. Like I said, each of the communities have more than 1 or 2 people trying to cover the community. Plus, the community get to know the people and feel a little easier. The relationship is there to come to us or to call on us if there's problems, and we can help direct them in the right direction, hopefully, and do a lot of intervention type of things.
Good. In case Carol Finley is watching, we'll just address Carol sitting right over there. She said, I'll never get her on my show, so she will be the 3rd person here today. Even
Hello, Carol.
Even though we don't see her. Of course, that's sort of life too, isn't it? Cool. So you got a health fair coming up. When is this, and you know, where's it going to be? And
okay, we have 2 health fairs coming up this next week. The 29th will be at the complex.
Okay, 29th of October.
October.
Okay.
9 to 12 and 1 to 4 in council chambers.
Okay.
And then on the 31st, which is apropos,
Halloween. And it's Halloween.
is at housing in their conference room. And this is basically for housing in S&K Electronics. So one at the complex is being advertised open to people who just want to stop in and take part in.
So what if somebody couldn't make it to the one of the complex? So could they come to housing? Is that okay?
Yeah, they can. We just, it's a smaller area, and so it's there, and we will serve them, but...
not as encouraged.
Well, it's just a smaller area, so if we can get them to come to the complex. If not, they can sure come to housing, and the hours are the same.
Okay. What are you going to do in the health fair? I mean, so if somebody's sitting out there saying right now, well, it's a health fair, why should I go? What are they going to do?
Well, we do screening and looking at prevention issues. We are doing weights, and we ask everybody their height. Unless they want actually measured, we don't stand them up and measure them on the height board.
How many women truly give you their true height?
Oh, how many men give us their true height? Women might be weight. Men, I don't know.
Okay.
Blood pressure, blood sugar, cholesterol, immunization, which includes the influenza, the pneumovac immunization, tetanus. We do a few hepatitis B if they're in a job that needs to have that as part of their job requirements. It's not something we give across the board, but if it's part of the job requirements, we do give that. We're going to have somebody there doing body composition. There'll be nutrition counseling. There'll be a table regarding cancer issues. There'll be information on diabetes and hypertension. There'll be a table looking at fetal alcohol syndrome issues, and then at the one at the complex in the afternoon, the mammo van will be there from 1 to 4 to do mammograms.
Now, what's a mammo van for?
A mammo van it is set up so that people, it's a on-the-road show to do mammograms. Instead of having to go to a clinic or the hospital to have the mammograms done for women, they drive it up to your door and you can have it done right there.
How long would that take?
It generally, mammogram generally takes about 20 minutes to a half hour. Kind of depends on the waiting time and, you know, whether you're first in line or if there's other people, but it doesn't take very long. And it's recommended for everybody over the age of 40 need to have at least a baseline on that. So, and if people are interested in that, they're to call our office in Ronan at 676-0137 and schedule a time so there's not a big backup.
So you are doing the scheduling, because I know that the van will be in Elmo, and is Sandy Sorrell doing that?
I'm not sure. I think the Elmo group basically is scheduling for the Elmo. We were giving the task to scheduling the one at the complex, and so I believe the Elmo team is scheduling the ones in Elmo that morning.
Okay, so what is the phone number in Ronan that they would call?
676-0137.
Okay, and do you know the Elmo number?
849-5798.
All right. So if you do want to get hold of them for your mammogram, do get hold of the Ronan Clinic, which is 676-0137, or the Elmo Clinic if you want to do it that morning, which is 849-5798. What use is the health fair? I mean, has it been useful in the past?
I believe it has. There's a lot of people out there, especially in the age from about 18 to 40, that frequently don't go to the doctor, and this is a large of our working population. So if we can go in and they can come in and do a real quick, what's my blood pressure, what's my blood sugar, being diabetes is such an issue here, and so is high blood pressure. We can do a screening. If it looks okay, we tell them to come back in a year. If it's abnormal, it's a little high, then we generally either set up a time when they can come back into a clinic and have it rechecked, or if it's getting up in the high normals or above normal, we may refer them to a doctor and then later follow up with them to make sure. Almost every year we have come up with a new diabetic. And that's the way the first diagnosis they've been is there. I have a client who we screened one year and his blood sugar was a little bit high, and we screened next year and it was really high, and later on he told me, almost called me a liar, but he went to the doctor and is taking care of himself. So
He is.
yeah, you know, so I believe, you know, even if we only pick up one person,
that's a tremendous benefit. You know, prevention goes a long ways. What about somebody out there might be thinking about, can I go to this who works for the tribe without permission from my boss, or should they, you know, get hold of their bosses? Are they administration behind this health fair?
It has been behind us. They allow them to kind of float in and out depending on their work schedule. We send out memos so that people can kind of plan their day, you know, so that they can float in and out. And you know, we always get the rush at 9, we get the rush at 1, and we get the rush at 4, but that's that. And, you know, if there's somebody out there that absolutely, for whatever reason, can't get into the health fair, then they should probably contact the public health clinic or tribal health clinic in their area and see if they can't set up a time when they can have this, you know, just walk in there and have the screening done.
All right, that's really good. You know, we talked about what's going to be done. As far as the test, we're looking for certain symptomologies, you know, conditions that might be arising, some warning signs. Is there anything people need to be scared about?
Well, I hate to use the word scared in a way, but be aware of. Blood pressures, people who, some of the symptoms, and they can be very slight symptoms, if you constantly have some edema or swelling in your hands and feet, don't have any idea, you should have it checked. There's other reasons, but that's one. If you have a bloody nose for no reason, sometimes that's an indication. Ringing in the ears, those are just some basic that. Blood sugar, weight loss, extreme thirst, happen to go to the bathroom a lot, just not feeling good. You know, it takes less than a minute to do a blood sugar, and we have over 200 diabetics here on the reservation, so everybody's related to somebody that has diabetes through bloodlines.
And, you know, and that number would be much greater if not as many, you know, passed away either.
Right, it'd be a lot greater than that, yeah. And cholesterol is notoriously, people, you know, if you listen to the news, it's an issue across, and we're no different. So, but if you can get it, start working on it when you're younger, then you don't have quite so much trouble when you're older. And a lot of times you don't have symptoms with the cholesterol until you maybe have a heart attack or high blood pressure. This type of thing, it just kind of slips in there, and you don't really realize what's going on unless you do have it tested.
What numbers, you know, should a person start to be aware of with their blood pressure? Okay,
blood pressure is, there's the textbook picture of it is 120/80. We get concerned if you're looking like 140/90. We start getting concerned, and that depends on what's going on in your life. The 90 reading is affected by pain, it's affected by the time of day, it's affected by a lot of other things. So if we get that, then we have to go into the history, and generally if they have a blood pressure, that we recheck it just to make sure, is this, you know, did they have a real stressful day that day, and kind of thing. But we do caution them and then have them come in and be rechecked on that. Blood sugar, they're redoing the numbers, and the numbers I'm going to give are the old numbers because the others haven't come down. They're getting tighter in their control, a lot tighter. Blood sugar, if you have your blood sugar taken without eating or drinking anything, it should run somewhere between 70 and 110. If you've eaten something, about 2 hours after that, it should be below 140. Now, it's going to get a lot tighter than that, but those are the numbers that we're using right now until we get the official word on the others. Cholesterol, anything below 200 is considered good. I remember one time at 250 was considered good. Yeah, and 200 to 239, you need to start looking and maybe adjusting your eating habits, your exercise habits. Look at some health issues. Is there, does your family have a problem with high cholesterol? Are you on medicines that might cause this? If it's over 240, you really need to start looking at it. And like you said, 250 used to be normal. Now 240, we start getting concerned, and we frequently see 300s and above type of thing. I know my doctor tries to get me under 180, which, you know, I do it. And it's going to get stricter. The cholesterol's going to come down too, but you know, right now those are the norms that we're using. You can't have a diet like Frank Tyrell, right? Well, I don't know what his diet is, so. Well, it's pretty scary sometimes. But it's sort of Twinkie, but all right. Kind of like Larry's. That's right. That's right. You know, what it's looking like to me is these health fairs actually are awareness fairs, that you try and make people aware of certain numbers, certain things, prevention. Right. Can you tell me a little bit about prevention? What is your community health team doing in prevention? Well, prevention is something that's the basis of public health, period. If we can work to prevent something, then we not only save dollars, we save lives, we save a community. And as our team is getting, like you said, it's only been together for a couple of months, so we're still working out on what are we going to do and where are we going to do. Yep. With Two Eagle in our community, I would imagine we're going to be spending more and more time looking at prevention on this age, because if you can, you know, change them there, then you've got them, but it's a difficult age, and they have lots of risk factors, and a lot of peer pressure. A lot of peer pressure, and you know, they're just, being a teenager is hard work these days. And well, it was tough when we were there.
long time ago.
Yeah, and I think it's tougher now. I really do.
Yep.
I think it's a lot tougher.
So what do you think about the mammograms van coming in, the mammo van? Is that a big benefit for the reservation, for our people, or?
I think it is because there's a lot of women that to have a mammogram is you're there, you're undressed, you've got to go through an uncomfortable procedure. And especially some of our older women, to go in and have somebody do this and that, they might do it if it shows up at their door. But to take the effort to get into the hospital, to get into a clinic or that, it takes an effort to do it. You have to be committed to do that.
Yeah. And last week we actually talked about breast cancer awareness, and the practitioners that are coming out are so well trained in being sensitive to this issue, and it's not like it used to be.
No.
And so they're taking them step by step, and they're very cautious with the person as well as courteous to the person.
And very, it's in a confidential, quiet environment to where there's not a lot of other stuff going on. And I think in a way the mammo van, that helps because there's not room in there for a lot of people milling around like in a doctor's office and a clinic and that type of thing. And
all right. Well, that's good. Now let's get to some really sticky issues.
Yes.
Recently in the Pablo community, some youngsters found a hypodermic needle. It turned out to be a diabetic needle. I understand, were playing with this needle and decided to become blood brothers or whatever. And
I don't know what their reasoning was.
they stuck their thumbs or their fingers with the needle. And you want to address this just a little bit?
Yeah, it was a real scary situation, not only for the children who are small children, but for us as professionals in the medical field. Number one, where did the needle come from? Number two, who used it, which we have no idea, or was it even used, but we have to assume that it was, and we have to assume that it was used by somebody who maybe had a disease that they could pass on.
You have to assume the worst scenario.
Yep. And, we don't know how long it was kicking around out there in the dirt, so we don't know what it may have picked up there. So the process that we had to go through with these children is we had to draw their blood for an HIV test and a hepatitis screen. The HIV test will be repeated in 3 months, 6 months, and a year, just like any other dirty needle stick type thing. We had to give them gamma globulin to boost their immunity, so in case there was something on the needle, it'd help them fight that off. If they hadn't started on their hepatitis B series, we had to start that. And if they hadn't had a tetanus shot in the last 5 years, they got a tetanus shot. So it was pretty traumatic to these little kids for a couple of nurses to come into their home and pull out all these needles and stuff. And so we're doing some, there's been flyers sent out to the area. There's going to be flyers sent out to all the tribal housing units. There is going to be something in the local newspapers. Some of the schools are working on that. Head Start's going to do a presentation to the children about if you find a needle, what to do with that.
And what not to do with it.
And what not to do with it, yeah. And any time that we use a needle and the cap is off, whether we inject it in somebody or what, it becomes a dirty needle.
Right.
You don't want to recap it. And what we use are these nice little sharps containers. And when they're full, we send them to a place that they dispose of them properly. We give these out to diabetics who have either the syringes or the little lancets to poke their fingers, and then they bring them back to us. Our recommendation is anybody that has use of syringes, anybody, that they figure out some way of putting them in something that's impermeable and has a good cap on it.
Right.
This is a makeshift. It doesn't have a cap on it because we couldn't find one when I was looking, but the syringes will go right in there, and you can screw the cap on and, put it high away. You can even take an empty coffee can and good old duct tape, tape the lid on, and this one is less than but it's better than nothing, and then Cut a hole in the top that's just big enough for the syringe. Once these are full, don't dump them out. And we've had people that did that. Oh yeah, I just dumped them in the garbage. We don't want those syringes in the garbage. They can be taken to the tribal health clinics in all of the areas, or Family Health Clinic in Ronan will accept them, and then they are dispensed. BFI out of Missoula has a big dispensing place, and they collect them all up and take care of them so that they're not out there. But and if anybody's got any question about that, call the different clinics, ask about it. Like I said, we have diabetics or people who are on some kind of injectable medicine. We have these and we hand them out.
And in fact, any one of the 4 clinics will accept them,
Right.
which is St. Ignatius, which is Ronan, which is Polson, and Elmo. And I would assume even the hospitals would accept
I wouldn't be a bit surprised they were. The only one I know for sure is Family Health, you know, outside of our own facilities. But I think the hospitals, especially after this last little thing, I think they would be more than glad to accept these and dispose of them properly.
You know, and I guess this is the point where I can, stress something. You know, parents, educate your children about needles, about things that are out there, because there are a lot of amazing diseases out there.
Yeah.
And the chances of them getting it are small. But the risk is great.
It only takes one.
Yeah, the risk is great, and you're risking a life, you're risking your health, and so we at Tribal Health would encourage you to sit down with your children, any of you who are diabetic, and teach them about the needles, about how to dispose of them and not to play with them, the lancets.
If nothing else, the sharps, like the lancets, and they're little plastic with a sharp end on them, and the needles, if nothing else, teach your children, if they find those, to tell an adult and leave them alone. And then the adult, make sure when you pick it up to dispose of it, don't pick it up by the needle, pick it up by the other end, and don't point the needle towards you at any time.
You know, I've had to, teach my children about my medication. And they're very powerful meds that I take, and they know that if they ever find one that does drop on the floor, they give it to mom, and so and hopefully they continue to follow them. All right. Alert, recall, condoms. Barb, tell us, quick, what's wrong? We're not safe.
And we're not safe, yeah. Anybody that's been listening to the TV knows that they are doing a recall on the Lifestyle Prime and Contempo condoms because of the spermicidal lubricant is causing the condoms to fall apart. So they're recalling. We were dispensing Lifestyles Extra Strength with the spermicide. On the end of the package, there's expiration dates, and if the expiration date is any date between 10 of 97 to 4 of 2000, they need to be turned in.
That's April of 2000.
April of 2000, they need to be turned back into the Tribal Health Service, any of the clinics, bring them in. There is a number if anybody is interested, and it's on the news, it's in the paper, but it's 1-800-883-3434, and they can help you decide what to do. Once we get replacements, we will be dispensing them again, but right now we do not have any that do. But if you have any Lifestyles out there, give us a call or bring them in.
So know that you're not protected.
Know that you're not protected against anything. Pregnancy, STDs, anything there. They're not working.
So are we saying that June 1998 we'll look for an increase in population in the valley?
I hope not.
All right. So do become aware of that, and it's sort of a laughing issue, but it still is a very serious issue because of the protection that they are offering for many things.
And assuming it's okay, and I don't know how many thousands and thousands there are out there, but...
Well, I would hate to be the company that's responsible. I'm sure they're responsible for a lot of different things. So, Barb, what else is going on in the Ronan Community Health Team? Anything in the future coming up, or?
Well, we don't have anything specific coming up other than we are really looking at what we see as the community needs, and spending some time of addressing that. what can we do in the next year or 2 years? One of the things that the community teams in general are looking at is the top 5 health issues within the communities, and once those are identified, then how can we access that? Car seat safety is something that's been identified, and there's going to be some training coming up that some of the people are going to. And then we're also looking at trying to do a car seat program of some, and getting some people educated on proper installation and how to check car seats, because there's a lot of them out there that aren't any good.
Right. Well, it surprised me at a meeting the other day where they were talking that 54% of tribal employees buckle up.
Yeah, and that's going to be something else, and we're not really sure how we're going to do that, but something just to make an awareness of that. When we look at the deaths that we've had in our community over the last few months, it's several of them were related to no car seat, buckling up.
And we know how dangerous Highway 93 is, and so if any highway in the country you should be buckling up on,
That's right.
Highway 93 should be one of those. Something just came across my mind, and you know how my mind works. You're a little bit scared. But actually, the influenza shot, the flu shots. What days are you guys giving shots?
We're giving shots on Tuesdays and Thursdays at the Ronan office.
Okay.
I don't have the other offices.
Polson's Mondays and Wednesdays.
And I think Mission, I think it's Mondays and Fridays, or I'm not.
Call your
clinic, yeah, because it's hard enough for me to keep track of what's going on, and I should have written that down, but I didn't. Call your clinic, and if you can't make it those days, then there's a possibility that you can, but it has to be a special thing for them to come in on other days to really try, and at the health fairs, come in and we'll.
So in the health fair, everybody come in, get your shots, get it taken care of then, and take some of the pressure off the rest of the week for our nurses so they can go out and do other things. Well, Barb, we're winding down now. I've got one last question for you. You always know that. And we were sitting here talking earlier before we came on the program. How many years have you and Gary been married now?
Okay, now what are you up to?
I'm just curious.
Well, we were married the year that Mount St. Helen blew.
What year was that?
You figure it out.
This year my sister was married. Well, all I just want to say is, Gary, if you're watching the program, take your wife out. She's done a great job for me today, and she's always a blast to have on the program. So anybody out there, if you have a question to ask Barb Plouffe, get hold of her at the Ronan Health Clinic, and I want to thank you all for watching today, and we'll see you next week. Goodbye now.
Good Medicine is your program. We hope you watch this and subsequent programs to stay informed about your health care, and we'd like to hear from you about how we're doing. Please direct any comments or suggestions you have to us. You can reach us at